When we think about fighting cancer, our minds immediately go to things like chemo, radiation, surgery, the big guns. But what if one of the most powerful weapons in a patient's arsenal is something we tend to overlook? Today, we're going to dive into exactly that, why nutrition isn't just some side issue in cancer treatment. It's actually a central pillar for success. And we're basing this on incredible insights from clinical dietitian Beverly Rogers. Let's jump right in. To really grasp how big of a deal this is, just look at this number, 80%. That's how many cancer patients could end up with malnutrition while they're going through treatment. Think about that. This isn't some rare, fringe complication. It's a massive crisis hiding in plain sight, and it directly impacts a patient's ability to fight their disease. So here's our game plan. First up, we're going to pull back the curtain on the hidden threat of malnutrition. Then we'll get into the actual toolkit you can use to spot it. After that, we'll cover some super practical strategies for intervention. And finally, we'll wrap it all up with the bottom line, the stuff you absolutely need to remember. Okay, so let's start with the problem itself. Let's really understand the scale of this hidden threat and why it's so consequential in cancer care. Now, here's what's really wild. The fight often begins on the back foot. Somewhere between 15 and 40% of patients are already malnourished the day they get diagnosed. That means we're trying to play catch-up before the first round of treatment even starts. And the consequences? They are absolutely devastating. We're not just talking about feeling a little weak. Malnutrition can literally cause treatments to be delayed. It leads to longer, tougher recoveries, more trips to the hospital, and this is the most critical part. It can directly lower a patient's chances of survival. It's a total domino effect. This brings us to a really important term, cancer cachexia. You can think of this as the point of no return. It's the severe state where the body is just wasting away muscle, driven by inflammation. And the scary part is, once a patient gets to this stage, it's often impossible to reverse. So pretty much all nutritional intervention is about stopping a patient from ever getting on this slippery slope. So which patients are the most vulnerable? Well, this chart spells it out pretty clearly. Patients with head and neck cancers, GI cancers, and lung cancers are at a much, much higher risk. For any healthcare provider, seeing one of these diagnoses should be an immediate red flag to start paying close attention to nutrition. Okay, so we get it. The problem is huge. So how do we actually spot it before it gets out of control? That brings us to the solutions. Let's talk about the assessment toolkit, the practical things we can use to identify risk right there on the front lines. And this is a message for every single nurse, every caregiver, every family member. You are the first line of defense. You're the one who sees the patient every day. You have the power to catch those early warning signs that a doctor who pops in for 5 minutes might completely miss. And it can all start with a few simple questions. Just asking, hey, are you eating less than you normally do? Or has food started to taste weird? Can open up a whole conversation that reveals a patient is really struggling. This isn't some complex medical test. It's just about being observant and compassionate. And when we do talk about weight loss, we need to have clear benchmarks. This chart gives us solid numbers to look out for. I mean, look at that top line. Losing more than 2% of your body weight in just 2 weeks? That's a huge warning sign. But that 1-month mark is really the big one, losing more than 5%. These numbers give us the objective data we need to say, okay, we need to act now. And it's not just about the number on the scale. You can actually use your own eyes and hands. This nutrition-focused physical assessment is broken down into 4 really simple checks. Hollowing temples, a clavicle bone that's sticking out, or muscle loss in the hand. These are real, visible signs of muscle and fat wasting you can spot right at the bedside. So now we know how to spot the problem. Let's get to the good part. What do we actually do about it? Let's dive into nutrition intervention strategies, real practical solutions. And just to really hammer home why this is so urgent, in lung cancer patients, losing as little as 2 to 5% of their body weight has been proven to decrease survival rates. Every single pound matters. The stakes are just that high. So, how do we jump in? Well, for common side effects like fatigue and nausea, the strategies are pretty direct. With fatigue, the answer isn't just more rest, it's more fuel, specifically protein and calories. For nausea, it's about being smart, taking meds ahead of time and trying things like tart foods or steering clear of greasy stuff that can trigger it. Pain and diarrhea are massive roadblocks to getting nutrition in. The trick is to get out ahead of them. So, for example, timing pain medication so it kicks in before a meal can make the difference between eating and not eating. And with diarrhea, it's a two-part attack. Use meds to slow it down, but at the same time, you have to be aggressive about replacing those lost fluids. When food just doesn't taste right, it can be so demoralizing. A big piece of advice here is actually a mental shift. Start thinking of food as fuel, not just for pleasure. And simple tricks like using a straw to bypass some taste buds can really help. For dry mouth, easy things like baking soda rinses or sucking on hard candy can provide a ton of relief. Okay, this is a big one. This slide tackles a super common and pretty dangerous myth about antioxidants. Here's the deal. Getting antioxidants from whole foods like fruits and vegetables, great, absolutely encouraged. But taking high-dose antioxidant supplements during radiation can actually backfire. Why? Well, radiation works by creating oxidative stress to kill cancer cells. If you flood your system with a ton of antioxidants from a pill, you might end up protecting the very cancer cells you're trying to kill. The takeaway is simple. Eat your antioxidants, don't pop them. So to wrap all these strategies up, boosting what a patient can eat is all about being clever. Smaller meals more often. Always pairing protein with a carb or a fat so the body can actually use it to build muscle. And leaning on high-calorie, high-protein shakes when a big plate of food is just too much. We have covered the problem, the tools, and the strategies, so let's bring it all home. Our final section, the bottom line. This quote from Beverly Rogers really just cuts right to the heart of it all. The goal isn't just about keeping weight on. It is about preserving muscle. Muscle is strength. Muscle is what helps patients tolerate treatment. Muscle is what fuels recovery. The entire focus has to be on protecting that lean body mass. So if you remember nothing else, remember these three things. Number 1, prevention is everything. We have to be proactive. Number 2, we have to redefine healthy food during treatment. High-calorie, high-protein foods are exactly what's needed. And number 3, celebrate every single small victory. A single pound gained isn't small, it's a huge win. It shows the trend is finally moving in the right direction. So we'll leave you with this to chew on. What if we started treating nutrition with the same level of urgency, the same precision, as the chemotherapy itself? What if the most powerful tool for a patient's recovery isn't some new drug, but what's on their dinner plate?